World. Now, before I go on, please note that interpretation of this event is available in all UN languages, whether people are speaking live or on video. If you click on the interpretation button, which you can see marked by a globe at the bottom of the Zoom screen, you can choose the language you would like. And that's if you're on Zoom, not if you're on YouTube. But back to the report. The hope is that this report will be fundamental for the millions of people working in the field of mental health, whether they're providers of healthcare, funders, advocates, or crucially, people with lived experience. Now, to introduce myself, my name is Claudia Hammond. I'm a writer and broadcaster, and I specialise in mental health. I've been presenting radio programmes and podcasts for the BBC for the past 15 years and have reported on the topic for a decade before that. Now, having interviewed thousands of people about their mental health, there is no doubt in my mind that it is essential for the world to take it extremely seriously if we are to flourish. And I've seen that with the right care, lives can be transformed. There's also a big change that I've seen during my career. When I started interviewing people, I used to need to ask them whether they were happy for me to use their real name or not. Now I find that that is very rare and that more people do feel that they can have a voice. But of course, that is not everyone and that is not everywhere. And so I'm delighted that among our many eminent and inspiring speakers who are here to celebrate the launch of the report released today and who are demonstrating their own personal commitment to this area, we have several people with us with lived experience of mental health conditions, and they have much to share with us too. Now, almost 1 billion people across the world experience mental health conditions, and mental health is, of course, a crucial topic to address. Now, this is the most comprehensive report on the topic since the turn of the century, and we hope that it urges mental health decision makers and advocates to step up commitment and action and to change attitudes and approaches to mental health, to its determinants, and overall to mental health care. Now, during our time today, we're going to hear from eminent speakers from around the world. We even have a famous singer performing especially for us. And I'd like to extend a really warm welcome to all of you who have joined us today. So it is time for our first speaker, and I'm delighted to say that we have a video especially recorded for us from His Excellency, Mr. Alberto Fernandez, who is the President of the Republic of Argentina.
Buenos días. En primer lugar, quisiera agradecer a la Organización Mundial de la Salud por la invitación al lanzamiento de este informe. Los temas de salud mental vinculados a las consecuencias derivadas de la pandemia están cada vez más presentes en la agenda global. La pandemia es una experiencia muy dura que generó mucha incertidumbre, produjo muchas pérdidas, mucho estrés, sufrimiento, malestar, tanto individual como colectivo. Aumentaron diferentes cuadros clínicos y los consumos problemáticos. Y crece en el mundo la preocupación por los suicidios. En muchos aspectos nos estamos recuperando, pero otros requieren aún de mucho trabajo. En este encuentro, lo que nos importa es enfatizar la recuperación plena del bienestar psicosocial de la población, transformando la salud mental para todas las personas. En la Argentina, hace tiempo, estamos trabajando este tema con el Ministerio de Salud, con las provincias, con otros ministerios, sociedades científicas, con la sociedad civil, con los medios de comunicación, usuarios y usuarias. Atender la salud mental no se refiere, en este caso, solamente a un grupo de personas con padecimiento. En salud mental no hay vacunas, pero sí hay acciones. Por eso hemos lanzado la Estrategia Federal de Abordaje Integral de la Salud Mental y Consumos Problemáticos. Hay que empezar por hablar del tema, escuchar y ayudar a elaborar desde las instituciones y profesionales. Nuestro Estado promueve la escucha, generando espacios en el sistema de salud, en escuelas y en universidades. Cada una debe saber que no está solo. que una comunidad lo acompaña y que estamos trabajando juntos para salir adelante. Vamos a cuidar la salud mental desde una perspectiva de derechos, libre de violencia y desde el respeto a las diversidades. Quiero mencionar algunas de las medidas que ya estamos implementando en Argentina. Por ejemplo, la asignación de fondos adicionales al presupuesto por 4.000 millones de pesos que se suman a los 3.700 del presupuesto actual. La formación y actualización de recursos humanos de las jurisdicciones. El acompañamiento y la asistencia a las infancias y los y las adolescentes y los sectores poblacionales más afectados. La generación de líneas de financiamiento en hospitales generales para la atención en salud mental. La ampliación del sistema de la red asistencial de telemedicina. También la creación de una línea telefónica específica y gratuita a las 24 horas para la urgencia de la salud mental. La creación de un programa para el abordaje integral en el marco de la Ley Nacional de Prevención del Suicidio. La duplicación de la cantidad de efectores del primer nivel de salud que recibirán botiquines remediar centrales para la salud mental. Estamos creando una especialidad en salud mental comunitaria. Doctor Tedros, Secretario General de las Naciones Unidas, estimados ministros y colegas, la Argentina será un aliado. Cuenten con este presidente para tender puentes y extender este llamado urgente a invertir en todo el esfuerzo que transforme la salud mental y garantice un mayor acceso para todos y todas. Es mi compromiso. Muchas gracias.
Thank you very much to His Excellency, Mr. Alberto Fernandez. It's very interesting to hear about the steps being taken in Argentina. And in the report itself, you can find lots of examples of how different countries are tackling mental health. So from Argentina to Botswana, we are very lucky to have with us Her Excellency Mrs. Neo Jane Misisi, who is the First Lady of the Republic of Botswana, who's going to talk about a group of people whose mental health can be at particular risk. Thank you.
Thank you, Director of Ceremonies, His Excellency Mr. Alberto Fernandez, President of Argentina, His Excellency Antonio Guterres, Secretary General, United Nations, Dr. Tedros Adhanom Ghebreyesus, Director General of WHO, distinguished guests, ladies and gentlemen, good afternoon to you all. I'm most honored to have been invited to speak at this significant occasion, marking launch of the World Mental Health Report, Transforming Mental Health for All. If we're truly to transform mental health, we need to fully understand its key determinants. And these range from the embedded traditional, religious, and cultural norms, peer and societal pressures, to emerging determinants such as unlimited and unregulated exposure to technological platforms. Social media, of course, included. In many instances, mental health promotion and financing are prioritized and are not prioritized and remain stigmatized. Active engagement of communities and consumers of mental health services should also be given the due prominence, the ideal being appropriate quality services provided in an equitable manner without causing financial burden. Ladies and gentlemen, if we ensure that society appreciates mental health beyond disease, this will go a long way in addressing the stigma and misperceptions around it. If each one of us were to wear lenses which view mental health as a part of the daily struggles that people encounter with life stresses, coupled with being a part of an accommodating, empathetic community, this will transform the way mental health is perceived and addressed. This will in turn influence the way we define it, we plan for it, and resource it. In my view, addressing all of these through an all of government and all of society approach will ultimately transform mental health. Allow me to share some efforts made by Botswana in transforming mental health. Mental health is integrated with other services nationwide, and currently a comprehensive draft law is due to be tabled in Parliament. its intention being to create an environment that assures quality, equitable service, while promoting and protecting the rights of people who require mental health services. The government has also embarked on an exercise geared at enhancing capacity of the workforce that deals with mental health by supporting mental health specialists and upskilling general health staff, including those in related professions. Furthermore, there's a shift of service delivery towards non-specialized settings in the community, underpinned by the introduction of community health workers. Closely linked with mental health is the spiraling incidence of gender-based violence, which was exacerbated by COVID-19. I have used my role as First Lady in raising my advocacy voice by embarking on a national GBV prevention campaign, focusing mainly on increasing awareness and calling for men's active involvement in ending gender-based violence. We are working together with relevant stakeholders, including government, traditional leadership, the police service, the prison service, to ensure that comprehensive multispectral psychosocial support is strengthened. And key to all of this would be to transform the perpetrators to become influencers, advocates, and change agents against the GBV scourge. I am currently the UNAIDS Special Ambassador for the empowerment and engagement of young people in Botswana, where I champion critical issues that affect them. And supported by representation from multi-sectoral teams, I've had the privilege to interact with young people across the country as they voice their experiences, opinions, and suggestions regarding an array of issues, including HIV and GBV. And outcomes from these interactions provide valuable inputs to national policies and serve to transform service delivery. This is done in the context of a strategic framework for the First Lady as the UNAIDS Special Ambassador, and this framework runs from 2020 to 2023. The priorities in the strategic framework were developed with inputs from these young people, and they hinge around three areas: HIV and AIDS, social and economic empowerment, and mental health and wellness. And mental health and wellness is viewed as a foundation, in that a sound mind lends itself to sound life decisions and choices. This strategic framework supports programs that are being implemented at national level. And in conclusion, Director of Services, I wish to once more thank the Director General of WHO, Dr. Tedros Ghebreyesus, and team for inviting me to this launch. I commit to continue using my advocacy platform in supporting efforts which promote, service, protect, and transform mental health. I'll be happy to use my voice to support other related efforts towards transforming mental health, such as an accelerated awareness of substance abuse, which is also added to the burden of mental health disorders, particularly amongst our youth. I thank you very much. Thank you.
Thank you very much indeed, Your Excellency, for those words. Now, next, we're lucky enough to have some words especially recorded for this launch today by the Secretary General of the United Nations, His Excellency, Mr. Antonio Guterres.
We are living through a global mental health crisis. Nearly 1 billion people around the world, including millions of children and young people, have a mental health condition. Most of them lack access to treatment. Services may be unavailable or unaffordable. Stigma also prevents people from seeking help. People with mental health conditions are at increased risk of physical and emotional abuse, denial of education and employment, and other human rights violations. The costs, both human and financial, are huge. Depression and anxiety alone cost the global economy an estimated $1 trillion per year. While the COVID-19 pandemic has increased mental health problems, it has also led to a far greater understanding of the importance and fragility of good mental health. Unfortunately, in most countries, mental health remains the most neglected area of health policy. In response, the World Health Organization is launching its World Mental Health Report, Transforming Mental Health for All. The report is a roadmap to guide countries in improving their mental health systems. It highlights where improvement is needed and how it can be achieved, starting in childhood and continuing throughout all the stages of life. It sets out ways to reduce risks, build resilience, and dismantle the barriers that prevent people with mental health conditions from participating fully in society. I congratulate the WHO on this timely report, and I recommend it to governments and mental health stakeholders everywhere.
Apologies for some of the sound problems some people were experiencing there, and also for anyone who's having problems with interpretation, rest assured the team behind the scenes is working on that. So thank you for your patience there. And thank you very much for those words there. Now, I've read this brand new World Mental Health Report, and it is extremely comprehensive. It includes all sorts of striking examples of what can work, and whatever evidence you might need in your work to see real change happen, the chances are you might find the statistics there that you need, because this is a really huge piece of work. Now, Dr. Tedros Adhanom Ghebreyesus is, of course, the Director General of the World Health Organization, and he is here with us on this very special day, and is going to say a few words on mental health and why it is we need this report.
Thank you so much, Claudia. Can you hear me?
We can hear you
loud and clear.
Thank you. Your Excellency, President Alberto Fernandez, Your Excellency, First Lady Neogen Masisi, Your Excellency, Minister Andrew Little, the State Secretary Byong Sanger, Secretary General Antonio Guterres, and also to all our panelists, would like to start by thanking Juliana Velazquez and Enoch Lee, Ahmed Hankir, and Anju Joy. Thank you so much indeed for joining us today. And we're very, very grateful, and I don't take it for granted. I really appreciate your dedication and commitment, and look forward to your words. And Excellencies, dear colleagues and friends, COVID-19 has underscored the intimate links between mental and physical health. The pandemic has taken a huge toll on mental health, a toll we don't yet fully understand. WHO estimates that already common conditions such as depression and anxiety have increased by more than 25% since the pandemic began, adding to the nearly 1 billion people who were already living with a mental disorder. At the same time, COVID-19 has highlighted the gaps in the capacity of health systems around the world to address mental health conditions. Investment in mental health remains low, and the stigma surrounding it remains high. On average, countries spend around 2% of their health budget on mental health. And in some countries, there are as few as 2 mental health workers for every 100,000 people. And yet, mental health conditions remain one of the leading contributors to the global burden of disease. We know it's possible to reduce the treatment gap for mental health. WHO's World Mental Health Report highlights the latest scientific evidence, showcases examples of good practice from around the world, and gives voice to people's lived experience of mental health conditions. The report calls for 3 fundamental transformations. First, to deepen the value and commitment we give to mental health. This means stepping up investments in services for mental health, putting in place evidence-based policies, and including people with mental health conditions in all aspects of society to reduce the stigma and discrimination. Second, to reshape environments that influence mental health. This means action to address risk factors for mental health, including violence, abuse, and neglect, improving early childhood development and banning pesticides that are associated with 1/5 of all suicide globally. And third, to develop and strengthen community-based mental health services. This means building community-based networks of services that move away from custodial care in psychiatric hospitals and integrating mental health services in primary health care. Using examples of positive change from across the globe, this report shows that every country, no matter its situation, can significantly improve the mental health of its adults and children. The personal narratives in this report show what effective health and social support looks like, how it can lead to recovery, and how much depends on individual and social context. The links between mental health and public health, human rights, and socio-economic development mean that transforming policy and practice in mental health can deliver real, substantive benefits for individuals, communities, and countries everywhere. Ultimately, investing in mental health is investing in a better future for all of us, because there is no health without mental health. Thank you so much, Claudia, and back to you, and look forward to listening to our panel today. My colleagues, especially Ahmed, very nice to see you online.
So lovely to see you, Dr. Tedros. I couldn't help myself.
Thank you very much, Dr. Tedros Adhanom Ghebreyesus. Just a word on the sound. If people are listening in English, if you don't have the translation on, when people are speaking in English, then you'll get much better, clearer sound. Now we have a treat for you. We're going to hear a song, because I am delighted to welcome the actress, singer, and composer Juliana Velazquez, who is joining us from Colombia. And Julia has just won the Latin Grammy Award for Best New Singer, which is very impressive indeed. She's going to perform a song for us, and then I'm going to have a quick chat with her. So over to you. Take it away, Juliana.
Good morning to everyone. Thank you. I'm really glad to be here. I'm Juliana. I'm from Colombia. I'm a singer, actress, and songwriter. I'm with Daniela Cabrera, co-writer and guitar player. And this is Cóseme, mi canción. A todas las personas de Latinoamérica y habla hispana, yo soy Juliana. Esta canción se llama Cóseme y es una de las canciones que no solo me ha cambiado la vida, sino que me ha hecho entender que la función de los artistas también es promover mensajes importantes y utilizar nuestra voz para comunicar cosas importantes para la humanidad. Y de la herida sálvame, que con la daga intacta en el interior, el tiempo no sabrá curar el dolor. Todo el sueño de careful, mis pies no aguantan el calor. No, ráscame la voz para que entiendas la razón del silencio y de mi frío. Píntame la piel con todos tus colores y sálvame de los trazos sin sentido y sana lo que duele, toma lo que quieras, límpiame sin pena. Me cuesta tanto respirar, sana lo que duele, toma lo que quieras, limpia de verdad. Y cóseme la piel, y de la herida sálvame, que con la daga intacta en el interior, el tiempo no sabrá curar el dolor. Todo el suelo es de carbón, mis pies no aguantan el calor. Oh, 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 oh. Agoté toda la fuerza que quedaba y te encontré. Y sin saber, yo siempre te tuve al lado. Ahí me desvié, camino siguiendo tu ruido. Me declaro perdido, me queda un respiro y te lo entrego a ti. Y no me aguanto más en este cuerpo, y si no abandono los recuerdos, tal vez se me agoten las ganas y el tiempo para respirar. Cóseme la piel que estoy herido, déjame entender que no he perdido, no estoy sola, sé que hay más. Cóseme la piel y de la herida sálvame, que con la daga intacta en el interior, el tiempo no sabrá curar el dolor. Todo el suelo es de carbón, mis pies no aguantan el calor. Oh, 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 oh. Gracias.
That was so beautiful and so moving, and there is a lot of love for you coming in via the chat, with people saying that it's how good it is for our mental health to hear you sing, which is lovely. And I wonder if actually people were asking what the lyrics meant. I wonder if you could tell us a couple of lines from that song.
Esta canción se llama Cóseme y la escribí hace 4 años. Yo tengo 24 años. Pero soy profesora de actuación desde hace mucho tiempo. Mi mamá también es profesora, es maestra de actuación. Y tenemos una academia de actuación para niños de todo Colombia. Y recibimos una noticia muy triste, y es que una de nuestras alumnas, con tan solo 17 años, se suicidó, decidió quitarse la vida en un momento de mucho dolor y mucha desesperación. Y eso a mí me generó muchas preguntas y mucho dolor. ¿Cómo una persona tan joven puede tomar esta decisión? ¿Cómo pudo estar tan sola? ¿O cómo no pudo encontrar a alguien con quien hablar en el momento que necesitaba hacerlo para no quitarse la vida? Y esto a mí me transformó el alma, y a mí, a todo mi equipo, a todas las personas que hacemos música, porque si nosotros somos artistas y tenemos una voz y una difusión muy grande, tenemos la responsabilidad de compartir mensajes importantes al mundo y de utilizar esa voz para poder repartir cosas importantes. Nuestros adolescentes y nuestros niños hoy en día están dentro de las tasas más altas de suicidio y de depresión. Y hay tantas cosas aparentes y tanta belleza en las redes sociales que en la vida real el bullying y la comparación constante hacen que sea mucho más difícil tener una infancia y una adolescencia tranquila. Así que Cose me habla de eso. Yo nunca he tenido depresión en mi vida, nunca he estado cercana a estar triste, pero quería hacer esta canción para que todas las personas que no hemos pasado por episodios de depresión y que no entendemos que esto es una enfermedad, nos podamos meter en los zapatos de las personas que sí tienen depresión, para no minimizar el tema de la salud mental y para entender lo desesperante y lo difícil que puede ser tener este tipo de temas y no tener nadie con quien hablarlos.
And I'm sorry to hear about the student. And I know that, as you say, you're very interested in mental health. And you promoted your album under the slogan, Talk to Heal. I even heard it's written on your gloves. Why did you choose that slogan?
Decidí utilizar la frase hablar para sanar porque creo que eso ha sido mi música para mí. Yo decidí empezar a escribir música donde hice catarsis, canciones donde fui muy honesta conmigo misma, y creo que también es responsabilidad de la comunidad pensar en la salud mental. Preguntarle a un amigo y mirarlo a los ojos si está bien, si está teniendo un buen día. Todos podemos salvarle la vida a alguien si nos lo proponemos, desde pequeñas acciones. No es una cosa que solo les corresponda a ustedes como organizaciones, es una cosa que nos corresponde a todos como seres humanos. Es tener un poco más de empatía y hablar sana. Cuando uno habla y uno a tiempo dice lo que necesita decir, sana, pero también cuando uno es escuchado a tiempo, alguien, un amigo, una persona desconocida, un papá, puede salvar la vida.
Well, thank you very, very much, Juliana, for talking to us today and for singing for us as well. That really was very moving and a very special experience. Thank you.
Gracias a ti, gracias a todas las personas que se conectaron. Doctor Tedros, primera dama, Débora, OMS, muchas gracias por la invitación y un respetuoso saludo para todos en todos los lugares del mundo.
Thank you. Thank you. Now, throughout this report, it is clear that listening to people's experiences of mental health difficulties and involving people in the design of services and in their own care is hugely important. So next, I would like to introduce from Beijing in China, Ms. Enoch Lai, who founded a consulting and training company to advocate for mental health at work, mainly in China and Asia Pacific. And she's also a board member of United for Global Mental Health. Now, thank you very much for joining us. You founded a consulting and training company to advocate for mental health. What made you so determined to change people's attitudes?
I think it's because I almost killed myself due to my own bias against mental health. And I started to realize that I was actually one of those who contributed to the broader problems that we had heard earlier in the session. And why do I say that? It's because once upon a time, I thought I had everything going for me. I did well in school. I had a jet-setting career. And when I see other people who miss their deadlines, don't show up at work or take sick leave for a long time, I arrogantly dismissed them as being lazy, incompetent, and wondered why they weren't as ambitious as I was. And until one day I found myself just unable to get out of bed, lethargic beyond anything I had ever experienced, and so hopeless and despaired that I wanted to end my own life. And I couldn't even comb my own hair or change my own clothes, let alone go to work. And that's when I understood depression. But even when I understood it, it took me a long time to receive help because I thought I was weak and a failure for being depressed. And
well,
also in that,
sorry, continue.
And also
Please
in that
continue.
experience, one of my ex-colleagues actually wrote to me when she found out I was going through depression. And she said to me, I get it. I was going through that at the same time we were working together. And that was when I really broke down in tears and in shame because she was sitting next to me for a whole year and I didn't realize that was what she was going through. And I think that's why now, having been on both sides of the fences, I get the disconnect, I get the misunderstanding. And if you think about me and times millions of people out there, that's what we see as stigma and discrimination. And so I really felt it in my heart of we need to take this fence down. We have to take this fence down. And to do so, I think we need to completely change our attitude, one of ourselves, what we think about mental health, but also how we look at others and help them transform the lens towards mental health. Because for me, if we put mental health on the forefront, that's really how I see we make the world a better place. And put simply, be kinder to ourselves and to each other.
Yes, very good advice there. And we're going to talk a lot about the need for better care. But I was wondering, how do people always even know to ask for some help, to ask for care?
I don't think so. And guilty as charged, because when I was even offered help by people who loved me, I was very reluctant to take it because one of the self-stigma as well, but also I didn't understand what it meant. And I think access to quality care is important, but also even knowing that I need to access that care must be the first thing. And I think we need to do that through the education, through the awareness. But it's not just about say, hey, here's a list of hotlines you can call and here's a website. It's really relating to the people, understanding that when they need help, they're quite fragile and delicate, and to help them understand that it's not because they have a defect or have a problem that we need to fix them, but that we're there to support them and also to empower them to speak out if they think that particular type of care isn't the most appropriate for them.
Well, thank you so much, Ms. Enoch Lai, for joining us today. Some really wise words, and I'm very glad you did get the care that you needed in the end. Now, next, I'm delighted to introduce from New Zealand, the Minister of Health, Andrew Little. And we hugely appreciate you joining us because you have stayed up very late in order to be able to join us live. So thank you very much for that. And the approach that you've been taking to mental health in New Zealand is closely aligned in the direction championed in the World Mental Health Report. And you're going to tell us a little bit about what you've been doing there. Thank you.
Thank you, Claudia, Director General, Secretary General, leaders of state, esteemed fellow ministers, colleagues, and all. Tēnā koutou katoa. Greetings to you all. My name is Andrew Little, as Claudia has said. I'm the Minister of Health in New Zealand. I have the privilege of speaking to you today on behalf of the Prime Minister, the Right Honourable Jacinda Ardern, who is unfortunately unable to attend the event. But I'm honoured to join you here today for the launch of this important report, Transforming Mental Health for All. It's the first of its kind. Developing our understanding and appreciation of mental health is incredibly important. Mental health has often been seen as a taboo subject, or even something refused to be acknowledged as a legitimate health condition at all, while simultaneously affecting large portions of the Earth's populations. We can and must do better, and I applaud the World Health Organization for leading this report. While often seen as a paradise at the bottom of the globe, New Zealand is not immune to mental health challenges. Our mental health system has been underfunded and undersupported for too long. It's heartening to see the direction outlined in the report is strongly aligned with the work already underway to transform New Zealand's approach to mental health and addiction to one where people are supported to stay well and have access to help that works for them. Similarly, considerable effort has been made to reduce the gaps and address the challenges highlighted in the report that are relevant to New Zealand, such as equity. We launched Kia Manawa Nui Aotearoa, Long-Term Pathway to Mental Wellbeing, in September 2021. This outlines our government's high-level plan for transforming our approach to mental health and wellbeing over the long term. This plan recognises that change requires a collective, multi-sectoral approach with government agencies working together. Kia Manawa Nui also emphasises the importance of engaging and listening to people with lived experience. I note the report highlights the importance of strengthening community-based care for all in need. This has been a key focus of our approach through a program called Access and Choice, giving people access to free and immediate mental well-being advice and support when and where they need it in a way that suits their needs. We're supporting new ways of reaching people, including by placing mental health workers directly in general practice clinics and enabling people with mild to moderate mental health and addiction needs to access support immediately and without referral. We're also partnering with local organisations to create culturally appropriate and equitable support for the priority population groups. We're rolling out tailored services for Māori, Pacific peoples, youth, and rainbow communities to provide support not always found in more mainstream services. The success that we are seeing from these programs speaks for itself. I'm also pleased to see the report acknowledges the importance and value of school-based mental wellbeing programs. We've seen this value in New Zealand. We created a program focused on building resilience to support children in schools following the devastating earthquakes in Christchurch over a decade ago. It has proven so successful that we have rolled the program out to other regions across the country, co-designed with local services and tailored to meet the needs of each community. We also acknowledge the need to better protect the human rights of people with mental health needs. As a society, our views on mental health evolve, and we now increasingly recognise the importance of well-being. 30 years ago, New Zealand's mental health legislation was viewed as forward-thinking, with its focus on providing community-based care in the least restrictive manner. But this legislation hasn't kept pace with a shift towards a recovery and wellbeing approach to care. We're therefore currently working to repeal and replace our mental health legislation with one that better protects people's human rights. There is plenty of work ahead, but change is already evident and the commitment and momentum is there. The Transforming Mental Health for All report is clear that we can and must do more to improve mental health, The same applies for us here in New Zealand. Supporting our people's well-being, both physical and mental, is vital to ensuring strong, resilient, and healthy communities. Tēnā koutou katoa.
Thank you very much indeed for that, Minister, and very good to hear what is happening in New Zealand. And we will let you get some sleep, although you may want to stay awake because we now get to the content of the World Mental Health Report itself. Now, as I said, it is very comprehensive, and I'm sure people will want to read it for themselves. But to get a flavour of what's there, we're joined by Ms. Deborah Castell, who is Director of the Department of Mental Health and Substance Use at the World Health Organization. And just to say, there's a few people still saying that they have some sound issues. If you go back, if you're listening in English and you go to the original English audio and you click on that when you've gone to the globe, it is sounding very clear there. But thank you very much for joining us. There are lots of things I want to ask you. First of all, why produce this big report on mental health right now?
Thank you, Claudia, and allow me to say thank you to all participants and speakers. It is amazing to see how many are with us today. I mean, in 2001 was the first time that WHO produced a global report on mental health, and that report at the time generated a momentum, some attention, increased awareness around mental health, the dimension of the problem, the challenges, but also we came with a way forward with the recommendations. 10 recommendations were listed in that report. Then 20 years later, the recommendations are still valid. Some progress was made, but if we can show just one slide with a few numbers, we today have nearly 1 billion people globally with mental health conditions. We have that 1 in 100 people dying are due to suicide. We have 15.6% of the years lived with disability that are due to mental disorders. And people with severe mental health conditions die 10 to 20 years earlier than the general population. So we maybe can remove that slide, but despite all this awareness, progress has been slow. And then we have, since then, and between then and now, we have the SDGs, the Sustainable Development Goals that included mental health. We have a WHO comprehensive action plan on mental health that was endorsed by all member states in 2013 that is still valid, with targets, with actions for specific commitments. We have the conventions of the rights of people with disabilities, the universal health coverage, a number of commitments that have been released and renewed over time. But nevertheless, a couple of more numbers, and I'm asking my colleague to upload another slide, please. We have there still big challenges. We in low and middle income countries, only 1 mental health worker or less per 100,000 population. People with severe, with psychosis, up to 71% of them do not receive any treatment. And those numbers are also big in many other conditions. Only 21% of countries comply with the human rights standards that have been endorsed previously. The financial support that governments are allocating to mental health is still around 2%, and most of that budget goes to isolated psychiatric hospitals. There is no budget available to provide mental health care at the community level. A number of other issues. So recently we entered into a big crisis, global one. One could say that was the COVID-19 and the pandemic, and how this has increased on one side the demand and the sufferance and the number of people suffering and in need of mental health care. but on the other hand, the challenges. And so more visibility came to mental health, more awareness probably to mental health. And we thought then, and answering to your question only now, we thought that it was a good moment to bring all this information together and to present the status of the current status of mental health. Not a very short answer to you, Claudia, but this
no,
is...
No, that's fine. No, we have some time to talk about this, so that is absolutely fine. And I mean, there are some extraordinary figures there, and there is a lot more data that might be useful for people in the report as well. Now, the report makes 3 big calls to action, if you like, and I'd like to spend some time asking you about each of those in turn and what can be done to implement them. So let's start with the first one, which is deepening value and commitment. What does that mean, and what needs to be done there?
Well, in fact, and I hope that the participants to this webinar will look at the report, because then we analyze exhaustively a number of issues from data and the different areas that we thought deserved deep analysis, and we bring a lot of experiences from a number of countries and people with lived experience, etc. And then we come up with those 3 main areas that were mentioned earlier by our Director General, Dr. Tedros. And then when we talk about the deepening value and commitment, we think that mental health must be valued as an integral part of health and well-being. It has not been so far, and we need to introduce this concept of the value that mental health itself has. We have deep discussions in the team that were involved in the production of this document on what do we mean, how do we measure that, and we believe that this is starts with the individual taking care of our own mental health, dedicating time and paying attention to our own mental well-being, but also then, of course, those around us. It was mentioned earlier by Juliana as well, listening to somebody next to us and giving a good word or a good ear sometimes, and paying attention to what the other says. But then, of course, that goes beyond that individual act, and it goes to the family, to the communities. Mental health has to be valued and be an essential part of the health care, and in general, it's also a basic human right. We talked earlier about the 70-something% of people that do not receive care for their mental health sufferings. Health is a right, mental health is a basic right, and so it has to be included there. And of course, a key component of public health, social well-being, sustainable development. So we believe that by introducing this value, then the commitment by all stakeholders that need to take action will happen, and therefore more resources, more human resources and financial resources, and investment, a decision by all those who have the power to take that decision, that things need to change, and that we know that could be changed in a good way, in a relatively easy way, in an accessible way, that will provide them the answers and the support that people need. So that's what we mean by deepening value and commitment.
And the next call to action, the next call to action is to reshape environments. So is that more about prevention?
Yes, it is. It is about prevention, but it is also broader than that. It is about protect our mental health, as we were saying just now, and prevent mental health conditions. For people with mental health conditions, it translates into equal opportunities to live, to learn, to work, to have fun, to be part of the community where they are. And we need to understand the social and the structural determinants of mental health, and intervene to reduce risks whenever possible, whenever feasible, and to build resilience and limit the barriers for people with mental health conditions to access the care they need. But also mean that adequate policies are in place. It is not just the responsibility of the individual, of course. Policies need to be there, other sectors, and not just health, need to play a role as well. And concretely, we are talking about spaces such as home, prevent, for example, violence at home, or promote nurturing care conditions that will have an enormous impact on the well-being of children, but also in the workplace, in schools, to prevent bullying, and eliminate any form of human rights violations, the getting up to the nature and the impact that we are listening a lot these days about of climate change on mental health. So all that needs to change. All that is part of the environment that will impact mental health.
And the final call is a big one, and one I'm sure that everyone would want to do, and that is to strengthen mental health care. That sounds like quite a challenge worldwide. How can it be done?
Well, indeed, this is a big one, and we need to change where, how, and by whom mental health is offered. We cannot delay a needed reorganization of services. A reform of mental health care is needed. On one hand, we need to move away from the custodial care that has been traditionally offered in psychiatric hospitals, moving towards community-based mental health services that could be of very different characteristics according to the possibilities, the culture, the context, the conditions that each country or locality will have, but services at the community level that are open, that are accessible to people when they need them. On the other hand, also services and programs with people for severe mental health conditions should also be accompanied or supported with also services for people with common mental health conditions that frequently are not even considered as a responsibility of public health, and there should be. And so in the report, we described a huge network of mental health services that should be established, but also we are concerned, and we are promoting the development of or the integration of mental health at primary healthcare level, of course, but also in the health system in general. Mental health cannot be seen always as an isolated and segregated area of work. So we have specialized mental health services. We have services that are part of the general health services, integrated with other health conditions, integrated with life course attention. But also we need mental health care offered by sectors that are not health, by education, justice, sports and culture, prison system, and many other housing, many other sectors that will have a role to play, or should have a role to play, or do have a role to play, and are not always involved. All that should conform a network of services of mental health care that will each country develop according, again, with its own possibilities. Big challenge, but it is doable, and we have plenty of examples in the report that could be seen. And perhaps I'm asking my colleague one last slide that is a bit of a summary, and if you allow me to look at for the interpretation, but we are just listening here the three main areas of transformation that we explained, and key actions under each one, just to summarize. But thank you, Claudia. Yes, that was my answer.
And I guess in a way, these three paths to transformation are all linked, aren't they? They all need to be done.
You can take them out. Yes, they're not optional, one or the other. They are all together. And the issue is that, as I said just now, the countries, each reality will, once the local authorities and stakeholders have decided that it is time to change the situation, they will decide what needs to be prioritized, how could they be prioritized, and then each sector has a role to play. The individuals, we said, of course, but also care providers, family members that will start better recognizing and respecting the mental health issues that they encounter, but also the community at large, promoting spaces that will generate the possibility to interact with people with mental health conditions, but also with promoting spaces that will allow that to happen. NGOs and academia that should continue doing the excellent work that has been done so far in terms of advocacy and research, but also increasing, if possible, their interventions. And of course, the health sector. The health sector has an enormous role to play. The health sector has to change a bit the way how has treated mental health so far and be more ready to incorporate these challenges.
And I think it's noticeable reading the report that although the figures you showed us at the beginning for the need that there is may seem bleak because the need is so large, that there are bits of good news in there as well. Things like I noticed there was a 70% drop in suicide rates in Sri Lanka after banning certain pesticides, increases in mental health coverage for some people in Peru and Chile, a drop in depression in rural India, a 10-fold increase in community mental health teams in Georgia. So finally, would you say some positive things are already happening?
Definitely. Thank you for bringing those examples, Claudia. There are many more in the report, and we were very careful in trying to illustrate as much as possible the good examples, precisely to show that things could happen, no matter the conditions. Good practices could take place, no matter the many challenges. So what we are trying to see is how this report could help others to learn what's being done and how to replicate, to copy, to learn from existing experiences to do much more and better. And that is why we firmly believe that it can be done, because it is happening, not at the speed that we would like to see, but it is happening. So perhaps we help pushing a bit harder this time.
Well, thank you so much for talking to us, Ms. Deborah Castell. Now, one of the things that the report calls for is to put people at the centre of their care and to engage and empower people with lived experience of mental health conditions. And I'm very pleased to welcome from the UK, Dr. Ahmed Hankir, who is a public engagement and education lead at the World Health Organization Collaborating Centre for Mental Health, Disabilities and Human Rights, which is in the Institute of Mental Health in Nottingham. Welcome. Now, we've been hearing about the report, and one of the things it calls for is for people with mental health conditions to have a real say in policy. Why is that so crucial?
Hello, Claudia. Hi. Can you hear me clearly?
Yes, we can hear you loud and clear.
Strong connection.
Yes, we do. It's good.
Greetings, peace to all. Happy Friday. I think it's incumbent upon me, Claudia, to begin by expressing my immeasurable gratitude. Isn't this amazing? In 2006, the trauma of the Lebanon War triggered a severe episode of psychological distress. I woke up one morning to discover that my hometown in Lebanon was bombed and that hundreds of people were killed overnight. I saw harrowing and horrific images of dead bodies strewn in the streets of Lebanon, dead babies being removed from the rubble. And I contemplated ending that which is most precious, human life itself. And I was ostracized, Claudia. I was stigmatized, shunned, and dehumanized by people who I thought were my closest companions. And I was made to feel like I was a madman and that I would never recover and that I would never amount to anything in life. And here I am sharing a platform with my hero, the Director General of the World Health Organization. I can't help expressing how much admiration I have for Dr. Tedros, my role model, and it's just a real blessing. And I think it delivers a very important, powerful, and clear message to everyone, to the world, that recovery is a reality for the many and not for the few. People ask me, how do we reduce mental health related stigma? This is how we do it, Claudia, by amplifying the voices of experts by experience. And that's how we contribute to a cultural revolution that normalizes mental health conditions, and that empowers and dignifies and humanizes people living with mental health conditions. Now, in response to your question, I really had to get that off my chest, Claudia.
That's allowed. That's fine.
Thank you so much. So in response to your question, our slogan, I'm sure you're familiar with it. There is no health without mental health, and nothing about us without us. People living with mental health conditions, Claudia, have been suffering in silence for far too long, and we refuse to remain silent any longer. We have voices, we can speak for ourselves, and we will be heard. And so that's why I think it's crucial that people living with mental health conditions are involved in the design, development, and delivery of mental health care services at all levels. That's how we transform psychiatric care, because policymakers and healthcare providers cannot afford to turn a deaf ear to what many people who are receiving psychiatric care are saying, that we are being coerced, that our human rights are being violated, and that we are being brutalized. And that's why, Claudia, the World Health Organization Quality Rights Initiative and the recently launched e-training are so crucial. And I would urge everyone, experts by experience, policymakers, health ministers, to complete the e-training. It's free and accessible to all. So to emphasize, we must involve people living with mental health conditions at all levels in the design, development, and delivery of mental health care services. Knowledge and data derived from empirical research are crucial. Of course they are, but so too are the insights and the wisdom derived from lived experience. And I would argue that's equally as important, if not more important. So that's a take-home message, Claudia.
And you've talked a lot very openly about your own experiences today and in many other circumstances, and you're also a psychiatrist. How have your experiences changed the way that you work?
Yes, I've been very honest and open about my experiences living with a mental health condition. I've embraced my vulnerability, and I identify as a wounded healer. I'm both a mental health care provider and a mental health care receiver and survivor. I think if anything, I perhaps identify more with the latter than I do with the former. I want to share a story with you, Claudia, because I draw on both my personal expertise and my professional expertise when I'm working in the front line of the National Health Service, when I'm working in emergency psychiatry. So I was asked to review a patient in the psychiatric intensive care unit, and I arrived and I noticed that he's a fellow Muslim of color, and he was holding a copy of the Holy Quran. And the response team were there, and they were about to restrain him, and they were about to administer some rapid tranquilization. And I was thinking and saying, vocalizing my thoughts, can everyone just slow down, please? Because I could relate to how he was feeling and how terrified he must be. So at that moment, I approached him with a greeting of peace. And I said, Salam, peace. And that was the first time he made eye contact with anyone. And I said to him, I noticed that you're holding a copy of the Quran. Does reciting from that scripture, any scripture, it doesn't have to be the Quran, it could be the Bible, it could be spiritual text, but he was holding a copy of the Holy Quran. And I said, does reciting from that Quran, does that comfort you? And he nodded his head. And so I invited him to recite in unison with me. And that's what we did. And tears of joy were streaming down his face. And no rapid tranq, no restraint, no coercive measures. His presentation, to sound like a psychiatrist, de-escalated. And so I really want to kind of emphasize on the kind of non-pharmacological approaches to mental health, but also how I drew on my lived experience, what I describe as a superpower, because it allows me, it empowers me, it enables me to develop authentic connections, a verbal rapport, a therapeutic alliance with people receiving care from me. So I can't emphasize that enough, that your lived experience is a superpower in the sense that it can make us more empathetic, it can make us more insightful, and it can make us more driven. So people living with a mental health condition, we need you to join our ranks as mental health care providers, because your lived experience is a superpower.
Well, that was very inspirational. Thank you very much for joining us, Dr. Ahmed Hankir. And thank you for that very powerful story there of the man, such a good example of what you're talking about. Now, it is hoped that this report will have an impact worldwide. And next, we're going to hear from Ms. Bjorg Sandkjær, who is State Secretary of International Development in Norway, who has kindly made a video for us.
Ladies and gentlemen, dear friends, congratulations to the World Health Organization on today's launch of the World Mental Health Report, Transforming Mental Health for All. We have been waiting for this report. More than 20 years have passed since the World Health Organization published its last World Report on mental health. The challenges were huge 20 years ago, but they are even bigger today. Almost 1 billion people live with a mental disorder. The COVID-19 pandemic has had a severe impact on the mental health and well-being of people around the world. But the pandemic has also raised the attention about the huge needs in this field. Mental health has been a neglected aspect of the development agenda. It's high time that mental health issues are fully integrated and prioritized in our work to promote universal health coverage and strong health systems. I appreciate that the report presents solutions. It's clear that a comprehensive and transformative approach and action both within and outside the health sector is needed to provide good mental health for all. We need to reshape environments that influence mental health and strengthen health systems to combat stigma and exclusion. Mental health is nurtured at home, at school, in communities, and at work. It's crucial to have a primary healthcare system with prevention, diagnosis, and treatment also for non-communicable diseases, including mental health. Unfortunately, we are far from that situation in most low-income countries. Most health systems are not equipped to provide good mental health services and psychosocial support. I recently visited Nepal. As part of my program, I met with the LGBTQ community and I visited a crisis management center at Patan Hospital, which offers survivors of gender-based violence medical and judicial assistance. These meetings not only impressed me with the work they're doing, but reminded me about the importance of strong health systems. Norway is proud to support the World Health Organization's special initiative on mental health, where Nepal is one of the 8 countries currently included. The program is a game changer and supports governments to develop strategies, policies, and capacities to deliver professional mental health services to the population. As the report states, investing to transform mental health means investing in a better life and future for all. Health is a human right, and Norway will continue to support the mental health agenda, including through integration in efforts to promote universal health coverage. We encourage more partners to join and support this work. Thank you.
Thank you very much for that. That was Ms. Bjorg Sandkjær, the State Secretary of International Development in Norway. And next, I've noticed that lots of people in the chat have been saying, what about schools and colleges and education? So next, we are focusing on young people, many of whom we know have had a very tough time during the pandemic. So I'd like to welcome from Delhi in India, Ms. Anju Joy, who has spent half a decade working to reform the public schools system in India. And she is the Chief Programs Officer now at Generation Mental Health, which is a youth-based global mental health organization. Welcome to you. Let me ask you, first of all, why is it so crucial to protect mental health while young people are still at school?
Hi, Claudia. Am I audible?
Yes, we can hear you perfectly. Yeah.
Okay, that's awesome. Hello to everybody from India, and thank you so much for having me here. In response to your question, Claudia, I think a a fact that often goes completely under the radar, right? And it goes almost unacknowledged, is the role that mental health plays in achievement, right? And especially in learning achievement, but also in any kind of success in later life, is often just completely neglected. And before transitioning to the field of mental health, which is now what I pursue full time, I spent over about 5 years in education reform in India. I've also been a teacher. And during my time as a teacher, I taught public schools. I taught in a public school in India, third graders and fourth graders, math, science, and language. And I think the biggest observation during my time as a teacher, which was also highly consistent, was that my students who struggled with their emotional health, with their mental health, were also the ones who struggled with accessing higher areas of their cognition, right? Children, and I had over 90% of my students were from low-income communities, came from really adverse circumstances, marked with alcoholism, abuse, and a wide variety of other difficult circumstances, right? And in class, I would try to teach them how to solve sums, but they had bigger problems to solve at hand. And that's just something I just noticed consistently. And I think, yeah, after 5 years, without a doubt, I think it's very clear that mental health and achievement have very strong and bi-directional links, right? And given the amount of time young children and adolescents spend in schools, it's highly important to integrate mental health care into education, right? And I think Ms. Deborah Kessler was talking earlier, it's about people having fun, right? And you cannot have fun at school if you don't feel safe, if you don't feel loved. So yeah, integrating mental health care into education, I think is of the highest importance.
So what can be done to change the environment at school to foster good mental health?
Yeah. And I think I just read this in the chat, right? I think somebody posted mental health is everybody's job, right? And what that means is teachers and other stakeholders in the education system also have a very critical role to play in creating conducive environments for learning for children and everybody else involved in educational settings, right? And I think one way to do it, and I think as a teacher, I did not experience this. I was a very young teacher at 22, no experience at all in classrooms. And I had no idea how to address the issues that came up in my classrooms, right? When I would hear stories of my students going through the kind of things that they're going through in their homes, I would be at a loss. I didn't know how to address it. What I knew was I had a syllabus that I had to complete, right? I had a curriculum that I had to finish, but there was no orientation towards how can I make my teaching and learning practices more trauma sensitive. And I think that's an orientation that not just teachers, school leaders, all stakeholders in the education system need to have to be able to provide safe learning spaces for children. It doesn't, I don't even think it needs teachers or anybody else to do anything additional, right? It's not some new task or new job that you have to do. It's just that you have to, whatever you're doing already, you just need to do it a little differently, right? You just need to acknowledge the fact that the student's mental health is important and perhaps is what will lead to any kind of learning achievement. And really, I think internalize, the knowledge that kids need to first feel safe and loved in order to learn. Right. I think just really holding on to that will transform, the way we look at classrooms, transform the way we look at education, I think. And I think in that process, what will happen is we begin to create a generation of young people who feel very empowered and who feel like they can make decisions in matters related to their mental health, right? And a lot of the work that we do at Generation Mental Health speaks directly to this, right? How can we give voices to young people to actually make decisions in matters that impact them the most at the end of the day, right? And hopefully build a resilient world. Thanks, Claudia.
And when you, I wanted to ask you something else. When you said you wanted to give voice to the young people, when young people are given a voice, are you finding that they are becoming happier to talk about their mental health?
Increasingly, yes. And I think you mentioned this at the beginning, right? Like in the past that you noticed that people didn't want to be named, people didn't want to talk about, there was so much more stigma. But I think as time is passing, as people are talking more about it, people are coming out to the front. And also I think as research and evidence are showing how strongly mental health is linked to almost everything else, right? There is change that is happening. And now I think people are a lot more open to talking about their experience. I don't think 10 years ago or 15 years ago, we would have people with lived experiences, right, on this panel. And today we have so many people talking about their lived experience. So yeah, I think that's amazing and change is happening, but of course a lot needs to be done.
And if you could do anything in schools in India, what would you do? Would you send all teachers for training then, or would you have other people come specially into schools as well? What would be your absolute ideal?
Yeah, I think it's a little bit connected to what I mentioned earlier, Claudia. Is just almost a reorientation, right? You don't have to do anything new. You just need to do the things that you're doing a little differently, right? You just need to acknowledge if your child is going through something difficult, you just need to feel equipped to address that, right? To reflect that feeling, to paraphrase whatever they're going through, to clarify how much is it impacting them, right? And that itself can make so much of a difference. And I think somebody else, I think Julia, in a performance talked about it, right? If you just listen, there's so much of a difference that can be made. But I think teachers right now are not oriented towards approaching education like that. So training, educating teachers, maybe grounding them in some of this neurobiology, right? Like how much is your emotional health connected to your cognitive abilities? I think that's extremely important.
And I guess it's hard because the teachers can't change everything about the rest of a child's life. They can't change the rest of their environment. They can just make school a safe place.
Yeah, I think what is within their control is, I think those 6 hours, right, that they get with the child in the classroom in a day is within their control. And so much can be done during that time. And I think that should be the focus.
Well, thank you very, very much for joining us, Anju. And very best of luck with your work as well in India. And lots of people talking on the chat there about what sorts of things could be done in schools and what sorts of things you could do in different places. Now, before we end, I'd like to invite back Ms. Deborah Castell, who is Director of the Department of Mental Health and Substance Use at the WHO, for a couple of final thoughts. And I wanted to ask you, first of all, how would you really like people to use this report and put it to best use? You know, we have people from all around the world here. What do you want people to do with it? How could they use it?
Thank you, Claudia. I think that when we were preparing this report, we were having in mind continuously the people working at country level trying to make a change, and how could we facilitate or support their efforts. That was the main concern and perhaps the target group that we were looking at. So I would like the report to be used for that. If the increased interest that we have discussed about, the increased awareness, many actors want to do different things in the countries, want to advance this agenda. Okay, we believe that this report should help them doing that there are enough experiences in each one of the areas that we mentioned to look deeper into them. There are scientific references all along the report to learn more about the specific ones that they may be interested in, or to get in touch, reach out to those who have done something interesting and explore ways of doing that. We firmly believe that a lot more than is happening could be done, more concrete actions from policymakers at every level, and we think that the report should provide the tools, should facilitate that information in order to then make that action take place.
And do you think then that it's having the evidence, it's having the experiences to look at, but also having good evidence and good data, can that make a change?
Yes, I think that we can assure those interested to move forward that whatever is written in that report is based on scientific evidence. And so the data is there and the evidence is there. It's just a matter of deciding that things could be done differently and then move on.
And the report includes, as you say, examples of action that have been taken in different countries as well. And these are really varied, aren't they?
Well, yeah, and I mean, it will be hard and unfair to name some because there are many, but you can have there a number of examples from different aspects. We try to to illustrate every single piece of information that we were included with an example coming from one reality or the other. And you have a number of countries from each one of the regions across the world, and not only from the farther East Asia to the other extreme of Latin American countries, or the African and the European and the US and Canada, everybody, or many countries are there included, but also different level of income or development, as mentioned, no? From low middle income countries and high income countries. We try to show that not always the development depends on availability of resources or the well-being of the country itself. It may depend on a serious commitment to make things happen.
And finally, in the future, in, I don't know, 10 years or 20 years' time, when the next big report like this comes out, what would you like to see that has changed in mental health? Can you paint a picture for us?
Well, I would like to see mental health care offered and available for everybody who needs it at the community level. I would like to see that places of isolation and segregation and punishment are not existing anymore. I would like to see that human rights violations are not easily associated with mental health or with people with mental health conditions. I would like to see people with mental health conditions speaking openly everywhere about their challenges or sufferings or achievements, and having a voice in every decision, as it was mentioned earlier by Ahmed. I would like to see that anybody at any place, at any time, going to see a carer, a health carer, to talk about their problems with HIV or diabetes or pregnancy or childhood or older adults, anyone going to see a carer will be listened also for their mental health needs or issues. And whoever will be on the other side listening to that will know what to do. That's what I would like to see, that mental health is part of health actively, in real life, in reality, and not just in slogans.
Well, let's see what happens, and I hope that all comes true. Thank you very much for joining us. Now, we are nearing the end of our time for this launch, and what a lot we've covered, from the very practical, like the 24-hour emergency telephone lines, which we heard about from the president of Argentina, the steps being taken in schools in India, to the big ambitions for global change, for change everywhere. We've heard some really moving experiences and songs. It's not every day you get songs in a global mental health conference. And we've also heard the real support there is out there at the highest levels, evidenced by the people who have joined us today, to make lasting change in this area. I was very struck by the words of the Director General of the WHO, who said investment into mental health is an investment into a better life and a future for all. And the First Lady of Botswana, who said how much difference it would make if everyone was part of an empathic community. And the Secretary General of the United Nations, who said in mental health, there are no vaccines, but there are actions. And I think all of these are such important phrases to remember. So Your Excellencies, colleagues and friends, thank you for all those supportive words. And thank you everyone who shared their personal stories and reflections. It has been so powerful to hear from governments, from mental health advocates, and from celebrities. And these are multiple voices, but they have the same message, that we must and we can do better for the world and its mental health. And I'm very much looking forward to seeing this happen. So thank you very much. Thank you for listening, and goodbye.